Hi, Vetfolio Voice listeners, and thank you so much for joining me for this episode, sponsored in part by Zoetis. For this episode, I was joined by Dr. Jason Stull to discuss infectious disease surveillance and outbreaks, something we have all become far too familiar with as of late. So for me, this podcast hit home a couple of different times because in addition to discussing infectious diseases in general, we talked about an outbreak of canine influenza that occurred in the Southeast not long after I graduated. And I remember that outbreak very well, so it was really interesting to hear the perspective of one of the disease investigators. Dr. Stull is an assistant professor of veterinary medicine at The Ohio State University and the University of Prince Edward Island. Over the past 15 years, he's taught and conducted research on veterinary infectious diseases with the main goal of protecting people and animals from infections. He's lectured to a wide audience on this topic, from practice managers and staff to veterinarians and technicians. He's conducted outbreak investigations and research on infection control-related topics. He holds a VMD from the University of Pennsylvania, a master's in preventive medicine from the University of California, Davis, and a PhD in veterinary infectious disease from the University of Guelph. He's a diplomate of the American College of Veterinary Preventive Medicine, and he had some great insights. Let's go ahead and get into it. All right, Dr. Stull, thank you for joining me today.
Hi, thanks a lot for the introduction and for the opportunity to speak with you.
Absolutely. We're thrilled to have you here, and we're talking today about infectious disease. So how did you become interested in veterinary infectious disease?
Well, my dad was a veterinarian, and he ran a small animal practice. Actually, it started out of the garage, right, next to the house. And anybody who has been in that type of situation knows what it's like. So, we were inundated as kids with veterinary medicine. But growing up in that household, I was always interested in veterinary medicine, but I wanted to do something maybe a little different, maybe have a slightly different path than what my dad did. In university, studied a variety of things, but really came across the field of public health, which I thought was fascinating, and the concept of epidemiology, or studying disease in populations. And eventually, I married that with my interest in veterinary medicine and kind of came across the field of veterinary public health. And so during a master's degree in veterinary public health, I further kind of went along with that and became really interested in infectious diseases. So kind of understanding the epidemiology of these diseases, the possibilities for new diseases to emerge or become apparent, to move from one location to another, outbreaks to occur, diseases that can move from animals to people or people to animals, and then potentially having the impact or the ability to not only kind of study them, but also to potentially control them, and in some cases maybe even eradicate them. So that's kind of how my journey went along. Early on in my career, I worked actually in public health. So I was a public health veterinarian for the state of New Hampshire, and I also did some of my training in California. And through that, those experiences also had an opportunity to observe and actually eventually develop programs in public health to try and address some of these infectious disease concerns. And so since then, I've really been drawn toward veterinary infectious diseases, and really excited with kind of studying them and learning as they change.
Yes, exciting and important, I think, as has been so clearly demonstrated to all of us here in the past year and a half. What's your most memorable disease outbreak investigation?
Having worked in public health, I was certainly involved in a lot of really interesting, sometimes scary experiences. Had the opportunity when I was in New Hampshire. We had a series of outbreaks, so each year, of Eastern equine encephalitis. So for those of you that are trying to go back in your memory box for that one, the specific disease, it's transmitted by mosquitoes. It's a bird-mosquito-bird kind of cycle, and then eventually these mosquitoes go out and they become infected with the virus and then pass it on to horses. They can also pass it on to people, and this is a highly fatal disease. So many horses will die from it, and people that become diagnosed with this disease, many of them will develop, permanent neurologic disease or maybe even die. So when I was in New Hampshire, we had an outbreak of this virus, and so we saw horses that were becoming sick. We saw some llamas and alpacas. Who knew llamas and alpacas lived in New Hampshire? But they do. Of course, people becoming sick with this disease. So that was certainly an important one and a memorable one. But probably the one that I guess I would say I learned the most from. I had the opportunity to investigate an outbreak of canine influenza virus in the southern United States a couple of years ago. So people that may be aware, a CIV or canine influenza virus made its way into the U.S. in 2015, and we've had, or I should say, the current variant made its way into the U.S. in 2015, and since then we've had a number of outbreaks. And so I had the opportunity to go to this particular location and to actually sit down with the veterinarians, technicians, and front end staff and practice owners, as well as with some boarding facility owners and daycare owners, to talk about their experiences. So what was happening, what were they observing, and a lot of moments that were around their own lives and how this particular virus was impacting them. And so this became not only, of course, the science part of it to try to better understand how this disease was moving, what types of precautions we could try and put in place, what were some of maybe the barriers that were not being put in place, but also to kind of recognize the emotions that came with the outbreak. I've obviously been involved with a variety of different things, but one thing that came kind of was really apparent. I remember sitting down with one of the vets, and he was talking about, he'd seen other types of respiratory infectious diseases in dogs before. But this one was really different. He described it like a train that hit his facility. And so we went from, one sick dog that morning to pretty much the entire group of dogs that he was dealing with in his facility, of all being sick, some of which ended up dying. So really impacted me quite a bit. They talked a little bit about, obviously, the challenges of also working with other facilities. So how do we not only deal with this outbreak from our own facility and our own staff, but how do we work as a community and the challenges that we face with that? How do we deal with public perceptions, other groups that maybe we don't oftentimes work with? And then also, of course, the obvious infection control deficiencies that unfortunately resulted in clinic-wide distribution of the virus and illness. And so I think, again, marrying the science with also some of the social drivers and some of the challenges really helped me appreciate the complexity of what we deal with, and obviously has a lot of similarities to what we're currently facing with the pandemic. And so thinking about, obviously, the individual patients, which we always do in veterinary medicine, but also really extending that and the importance of what we do at the practice level and what we do at the community level that can really impact infectious disease transmission. And, if we fail and can't be successful at targeting infectious diseases at all of these levels, then that's going to be a problem, and we're not going to be able to really have an impact.
Listening to you talk about the canine influenza outbreak in the southern United States, I mean, I'm here in Gainesville, Florida, so we were in a lot of those meetings, and I remember, the veterinarians from UF holding meetings throughout the community to talk about infection control measures and where do we go from here and what do we do if the outbreak gets worse and all of that. It brought back all kinds of just memories and emotions.
Mm-hmm. No, it really does, and I think there's nothing like an outbreak to emphasize to us what we do well and really where we need to do better. And that's something that, hopefully we don't need outbreaks to do that, but it definitely certainly is quite effective at showcasing that.
Sure. So can you share some of these effective strategies that help mitigate the number of sick pets during an outbreak?
Absolutely. And I think one of the most common errors, I guess, that I see is people not reacting as quickly as they should. And so certainly, again, don't want to draw a lot of parallels with the current pandemic, but we certainly know that infectious diseases can transmit extremely fast. And if we can target and we can stop or at least buffer disease at the early stages of a disease outbreak, where there aren't a lot of cases that are in the population, we potentially have the ability to dramatically change that curve, right, as to where it goes. So reacting quickly and reacting somewhat aggressively, and and I'm not saying that we should do things without inadequate information, but or with inadequate information, but we should try and make good decisions early on. And so we may not commit completely at the beginning, but even some simple basic steps to infection control and prevention can really mean the difference between an outbreak that is, or a cluster of cases that doesn't go any further, to having to shut down your practice and potentially being out of business for multiple days or even weeks. So what I'm talking about here are simple strategies that we all know. So the concept of quarantine, the concept of isolation. So obviously quarantine here, where we have individuals that may have been exposed to, for instance, the pathogen that we're worried about. So they've been in the same room, they've been next to the animal that's sick, and we take extra care of those individuals so that if they do become infectious, they don't spread it. And then the concept of isolation, where we have known animals that are sick and we remove them from the population so that they're not going to be transmitting the disease. Again, these concepts not only are important for large outbreaks and big concerning things, but even small stuff that we deal with in day-to-day veterinary practice. So, canine infectious respiratory disease complex, or CIRDC, with whether it's canine flu, whether it's parainfluenza, whether it's Bordetella. These diseases have a tendency to they can really mushroom, and if we act quickly, we make a big difference. So from there, it really depends a little bit, obviously, on the particulars of what the organism is, how it's transmitted, how infectious it is, and how aggressive, I guess, as a veterinary group we want to be. It really, though, comes down to some pretty basic stuff, and these are components that really every veterinary staff member, whether you're a veterinarian, whether you're a technician, whether you're a front end staff person, I'm sure is somewhat familiar with and really needs to kind of own. And so it's things like cleaning and disinfection. So that's really important, simple tool that can dramatically alter infectious disease transmission. Hand washing, and every time you say it, like everyone says, "What should we do?" You should wash your hands. It sounds like great. We have all this expensive equipment that we're investing in, and it's a little bit of soap and water or alcohol-based hand sanitizer that makes the difference. But you know what? It really is. It's the simple stuff that truly can make a huge impact. And in fact, hand washing, or what I like to say, hand hygiene, because it's sure soap and water is great, but alcohol-based hand sanitizer in general is just as good and is easier to use in a sense. It's incredibly effective and probably one of the most powerful, I guess, tools that we have against infectious diseases. Additional components, identifying new cases early and then putting precautions to stop them from spreading. And then, of course, long-term preventative measures. So if there's a vaccine available, absolutely, we should be using that. Those can be extremely helpful. And we can, talk a little bit about that as we go through today. But I guess, one of the areas that when I think about those that we typically even maybe struggle with the most is generally putting practices into action. And so how do we get our staff members, how do we get the public to kind of do what we think they should be doing? How do we ensure that individuals kind of understand what they need to do and why they need to do it? That's the difference between a plan that looks really good on paper and one that actually is effective and works. And there's a variety of kind of components to social behaviors that really can help us to better understand, to mobilize people.
Sure, absolutely. That makes a lot of sense. What are some of the obstacles that you've seen contributing to the spreading of infectious disease among pets?
I guess there's a couple here. The first one, and this might surprise some people, but it's around preventative care. And we talk about it, I think, to some extent. I think in general, we didn't get probably, at least if you're like me, I didn't get a great education on it. We kind of learned how to deal with sick animals. We certainly don't deal with diagnostics for sick animals, but maybe less time around the key role that preventative care can really play. And so we obviously know that they work at reducing infectious diseases, but I guess what's sometimes really surprising is to see sometimes the low uptake on some of these measures that we just think are kind of no-brainers. And so I was just recently kind of reading through AVMA, as many might know, has a pet ownership and demographics source book. It's a survey that they do every few years, and it's for dog owning and cat owning, and also other animals too, owning households in the US. And so I saw a couple of statistics that I thought were quite alarming, to be honest. So, for instance, there was one that said that 16% of households that had a dog said that the dog was on preventative care for intestinal worms. Just 16%. 36% of households that own dogs, that dog was on preventative care against heartworm, and only 51% of households with dogs said that their dog was on a preventative against fleas, ticks, or flea or tick-borne disease. And I'm kind of floored by some of these. A lot of times we think of maybe our own little world or maybe our best clients, but there's certainly a strong need to try and address some of these obstacles. And when we think about that, obviously some of these are at the owner side. So owners come in, they may not want to use it, they may not even be aware. But of course, some of these obstacles come down to the veterinarian and the staff members within the clinic. And so trying to help owners recognize the utility of preventative care, I think, is sometimes hard, and to help owners understand the benefits and the importance of the veterinary staff to really be able to communicate some of those benefits is really key. I guess another obstacle that I think about, and anytime we talk about infectious diseases, especially infectious diseases of companion animals, is around surveillance programs. And if you say, what surveillance programs, you're absolutely correct, because there aren't a lot. And that's really frustrating. So for someone like myself that is really interested and engaged in better understanding infectious diseases in North America and our dogs and cats, there's really not a lot to go on. We generally don't do a great job of tracking that. And so we have no real good way of looking at the utility of different interventions. So we've obviously had huge impact or huge changes in flea and tick based products over the last couple of decades. How has that impacted infectious diseases in the United States? We really don't know. So those are tough, and it's also hard because without those, it doesn't allow us to potentially forecast, doesn't allow us to identify diseases early on. And again, with what we're seeing these days, we recognize the utility and the importance of that. I guess another thing that's also important, and I think hard and a challenge for clinical medicine, is that diseases change really fast. And that means that we have to be at the top of our game all the time, right? So infectious diseases change. So we even have new tick vectors or vectors that become involved in infectious disease. We see new diseases emerge out of nowhere. We see them move from one country to another. We see resistance occur within, bacterial species. We see outbreaks happen. And these things can happen really, really fast. And so we also, though, at the same time, see some diseases that we've put a lot of energy and time into potentially, kind of dissolve and don't become as important. So this creates a real challenge for practitioners, for staff members to stay on top of what's occurring, to know best treatments and preventatives, diagnostics. Really, it's a lot. This means, a new skill set that we actually have to utilize. And so thinking about this concept of evidence-based decision-making, in other words, using the best evidence sets out there, and that's great if it's a randomized clinical trial, but generally it's not. It may be lower levels of evidence. It may be anecdotal information, but at least looking for that evidence and incorporating that evidence into our decision-making to optimize patient care, optimize client care. And that's really important. And it's becoming even more important these days with our ability to access things online and also for our clients to access them. And so really being familiar with the primary literature. Some practitioners, I think, don't feel comfortable with some of these skills. They haven't had a chance to hone them, certainly in veterinary school or even in clinics. And so those are some of the pieces that I think that we begin to get challenged by. And then I guess finally, when we think about this, is an underappreciation for some of the simple stuff, yet those that really can have huge impacts. And here, I'm kind of talking about infection control practices. So just as I spoke before about, the utility of simple things like hand hygiene, you generally will see people when I go to a clinic, we have a parvo dog or they have a panleukopenia cat. They do a really good job of identifying the infection control needs for those kind of really sick, high impact disease cases, but oftentimes not quite as good a job of instituting those same types of important preventative practices with patients that are not showing clinical disease, but can certainly be shedding pathogens. We honestly, every animal that comes into our practices and into our clinics is likely shedding something that's pathogenic. That's just the way it goes. So the importance of kind of having this standard, minimal practices that occur with every single patient, regardless of overt clinical disease, is really important. And for us to kind of appreciate the ability for animals to spread infections, regardless of clinical signs, is obviously another important component.
An ounce of prevention, right?
That's exactly it. You feel like you're getting old when you when you start not to claim anything against you there, but I've used the exact same statement, and I'm like, boy, I sound like my dad more and more these days. But it's true. It's really true. Every infection that you can prevent, and if you think about things like when we think about infectious diseases, you're not just preventing that one case, you're preventing potentially all the additional cases that were infected by that additional case. So it can have a huge impact.
Absolutely. And you probably better than anybody understand the importance of preventative medicine. And I know being a practicing veterinarian in a clinic, you see the negative impacts of people not practicing preventative medicine. But how do you convey the value of preventative medicine to pet owners?
This is a really good question. And I think one that our profession really needs to tackle quickly. We're seeing concerns around reductions in vaccination, as an example, vaccination coverage in some of our pets. We're starting to begin to see some trends that this is decreasing, and we need to figure out why, and we need to figure out what we can do to try and correct this. So I think there are a couple of pieces here. So when we think about decision making, it comes down to benefits and efforts in a sense. And so, as an example, the cost of preventative medicine is very clear effort, right? We know that when you're trying to have a conversation around an owner, they know how much the vaccine costs. They know the expense of the visit. They know concerns that they might have regarding potential side effects of maybe medications or maybe even vaccinations. Now, the other side of that coin, right? So if there's a large effort, a large cost involved, then there needs to be a huge benefit to kind of offset that to help clients make that decision. Now, helping people to recognize benefits, especially when it comes to preventative care, is more challenging. And this is the same challenge that we see in human health care or public health, right? So how many people did we, prevent from getting sick? We don't have a number. And so it becomes difficult. So we need to try and kind of make this more tangible. So I don't think there's a one size fits all solution here, but I do think there are a couple ways to get at it. And they include the concept of risk communication. They include, I think, storytelling, and they also include visuals. So let me kind of unpack those a little bit. So risk communication is not the same as education. So risk communication is really about an open dialogue with someone. Here, maybe we're talking about a client, and here we're trying to really understand what their hesitancies might be toward a particular issue, such as preventative care. So we're not just going to educate them on why they need to do it. We're going to kind of open it up for a dialogue or discussion, and we're going to be open. So in order for our client to really feel comfortable, shedding that and sharing that with us, they really do need to feel comfortable with us. We have to be careful about judgment and all of those components. And so with that, we may really actually get to the heart of why they, for instance, don't want to vaccinate their animal, or they don't think that they need to use a particular dewormer or something like that. Second is storytelling. And if you're like my father was a great storyteller, and I suspect he was really quite successful at vet med because of that. And these are just simple scenarios that you've identified over your career, maybe even from others. It's totally fine to steal them from other people that you've encountered that help to make these conditions real for a client. So instead of just reading about a pathogen or a disease on a brochure, it's around kind of talking about those feelings, talking about that condition and what happened to that pet. I'm not talking about scaring people, but I'm really trying to help people recognize that these are real things that happen, and they happen to other people at the practice, and they could happen to them. And then I guess the visual clues are a variety of different things. And so, I know people can use things like photographs or whatever that again, to help people recognize. So you go through and describe what, canine distemper does to a dog, and people maybe, oh, that sounds so fun. I don't want that to happen to my dog. But they see a picture of a dog that's head pressing into a corner, that obviously has a much more impactful component on that client. But it can also be things like even maps. So there are a number of great free websites that are out there that can be a tool to help show where certain diseases are potentially happening. I think of CAPC, the Companion Animal Parasite Council, as one group that is doing a nice job. And so helping to illustrate kind of what's happening in your own state, or if someone is traveling elsewhere, what's happening in that state, to help educate them and again have that risk communication around, these are some things that we want to be thinking about for tick prevention, here or as you travel. And finally, there's a lot of conversations around preventative care plans, and these can be very helpful, I think, to help make and drive home the importance of preventative care to clients. And so helping them recognize the costs and the cost savings, I guess, that comes with preventative care. So as a package, this is what you get. And also recognizing what happens if their animal, they don't take the package and their animal gets sick, and how costly some of these types of the care for some of these kind of conditions could incur. So, I mean, ultimately, the best approach will depend on the client, but using some combination, if not all of these, can be extremely helpful in trying to convey the value of preventative medicine.
Sure. I mean, a lot of what I hear you saying is just kind of opening that door for conversation instead of, well, I say yes and you say no, kind of creating a conversation around the subject to see where the hesitancy lies and if we can mitigate that fear or hesitance around preventative care.
Absolutely, and I think the big, of course, elephant in the room is who's got time. And that's an important one, and one that we all have to recognize. And so in order to make this successful, you need to ideally identify the clients that you do need to spend the time with. And so ensuring that, your technicians or other individuals that are getting that history for you, hopefully, or some of it, they can help you to identify the clients that you're going to need to spend a little bit more time. Also having, really at your fingertips, some of these components that we're talking about, which will reduce some of the time commitment. And then at the end of the day, really getting good at having that conversation and developing some really good talking points, I think is the way that we're successful.
Sure, sure. So lately, we've been hearing a lot about herd immunity. So, can we achieve that in our pets for some of the more common diseases?
Yeah, that's a great question. And sometimes you'll hear, we're talking about vaccine hesitancy or other things. You'll hear people use the term herd immunity. So I think it's really important to kind of understand what it is and what it isn't as well. So herd immunity is really kind of this collective immunological status of a population, right? So overall, as a large population. High herd immunity means that there's not a lot of individuals in the population that are susceptible. So they either might have gotten infected already, or they could have been vaccinated or otherwise adjusted in some way that they're not going to get infected. And it's difficult then if you have high herd immunity for a pathogen to really be spread, because chances are that one infectious animal doesn't come across many, if any, other animals that are potentially naive or susceptible. And so we can increase herd immunity, as I mentioned, by decreasing susceptible population through one means that we oftentimes talk about, and certainly right now is through, in general, vaccination. So I have the privilege of actually talking to first year veterinary students. I'm sure anyone that's a vet student out there and remembers their epidemiology course, you may remember it fondly, you may not. And I've encountered both types of students. But one thing I think that we can agree on is that there are lots of components around that are in veterinary epidemiology and first year vet year epi that are really exciting and interesting. And so, one of the things that I teach is the concepts around herd immunity. So, for instance, if we know what's called the basic reproductive number for a disease, and so people have heard this used around COVID-19. So this is in general kind of the average number of individuals that would directly be infected by a single infectious case. In other words, if we took one individual that's infectious and we stuck it in the middle of a bunch of individuals that are all susceptible, how many of them that are susceptible would truly get infected? And it's generally not all of them, right? So most of the diseases that we generally talk about in even human medicine, or certainly in veterinary medicine, are somewhere of having a basic reproductive number around 2 or 4, somewhere in that realm, right? So on average, anywhere between 2 to 4 individuals become infected from every infectious individual. But what's really kind of cool about that is if we know that basic reproductive number, then we can actually calculate how large of the population, what proportion of the population needs to be immune to stop or prevent an epidemic, or what we say is to reach herd immunity. So as an example, I've thrown out some numbers, basic reproductive number of 2 or 4. So if you have a basic reproductive number of 2, you generally need about 50% of the population to be immune to achieve herd immunity. With a basic reproductive number of 4, you need about 75% of the population to be immune for herd immunity. And so this is, certainly very much doable, 50%, 75%, although I've, also shown you and talked about some issues that we have with preventative medicine that we certainly are struggling with and need to address. But with a highly effective vaccine, that these numbers are definitely reachable. And with that, of course, then epidemics or outbreaks wouldn't occur, right? So yes, we may have kind of one-off infections. This also means for the clients that say, well, I'm kind of banking on herd immunity, therefore I don't need to get my animal vaccinated. That's not exactly true, because now your animal still is potentially susceptible to that disease. So your animal might be the only one or one of the few that gets infected. It just means herd immunity overall protects the overall population, right? So we need to really be clear in our own minds, in our clients' minds, really what that means. So just like any disease in people or other animals, we can certainly acquire, herd immunity for pets for some of these common diseases.
I'm hearing my internal medicine professor saying, yes, these are the overall odds, but for this individual, the odds are 0 or 100.
That's right. I love it. I love it. And so that's exactly right. And sometimes it's a tough conversation to have with owners to try and help people kind of recognize those pieces. And again, some of the pieces that we've already chatted about can sometimes be effective in swaying people from one extreme to the other.
Absolutely. So let's talk a little bit about diagnostic testing. How important is diagnostic testing for an individual dog?
Yeah, so I would say that really, as part of a preventative care plan, we've been talking a lot, of course, about prevention. So as an ounce of prevention, it's really kind of critical, obviously, for critical pets. And having a diagnostic test involved in that preventative care plan is key. It allows us, of course, to identify potential problems early. So ideally, if this is part of our preventative care plan, we identify individuals that have been infected early, maybe address concerns, and also even change and make changes to the preventative care plan for that particular patient. So as an example, we're finding an animal that tests positive against a vector-borne or a tick-borne disease. Yes, it means that they may have that particular pathogen, but it also means that they were bitten by a tick. So we need to obviously address the pathogen that may be in play here, but also around tick prevention overall. I think the biggest challenge, though, where I see clinicians appropriately using diagnostic testing is really ensuring that we have a plan for how to interpret the test and how to act on the results, right? So as people say, don't run the test if you don't know how to use the information. So as an example, we have that dog that's coming in for its annual exam. The dog's otherwise feeling great. We run our diagnostic test and we find that the dog has antibodies for Borrelia burgdorferi, the causative agent of Lyme disease transmitted by ticks. So if we have a plan as to how we're going to address that, and that plan probably is going to depend a little bit on where we're practicing, where that dog has been. I'm going to use some other, scary terms like the positive and negative predictive value of that test. So based on the prevalence of that disease in your region, you're going to have a very different, kind of approach to whether you trust that positive test or whether this might be a false positive. So that becomes extremely important to kind of include. And so if we have a plan, and ideally we have an evidence-based plan on how we're going to actually act on that finding, it's going to be much more successful. And so when I say evidence-based plan, this could, as an example, going with our Lyme dog, this could involve, for instance, following current evidence-based consensus guidelines. So there are guidelines out there, as an example, from ACVIM on Lyme in dogs. And as an example, this might suggest monitoring the dog for evidence of clinical signs or proteinuria, and then taking action should either of these be observed. So I think having a really clear plan can not only be extremely effective, obviously, for the veterinarian, but also extremely helpful as we begin to kind of navigate what these diagnostic tests mean and how best to address the care of that individual patient.
Sure. So we've talked about prevention, an ounce of prevention, and we've talked about Lyme in particular. Let's talk about vaccinating specifically. So some pet owners are concerned about over vaccinating. Do you think that they should be?
Such a good question and such an important question. I already mentioned a little bit about this concept of vaccine hesitancy that we're seeing and likely seeing more and more of. So let's start at the basics, right? So vaccines absolutely are a form of medicine. They, just like everything that we do in vet med, they should be used appropriately. They should be used judiciously, just like everything else and every other type of medication. So this means if you have a vaccine, you use it when it's indicated, and you don't use it when it's not indicated. And the benefits of an effective vaccine are huge. We've seen that. If anyone, if you're questioning the utility of vaccination, hopefully you have some vets that are at your practice that have been around since just when or practicing before the parvo vaccine was available. Have a conversation with them about what the parvovirus outbreak was like prior to the vaccine being available. And I think you'll have a very different approach, or at least an appreciation for the utility of some things that we take for granted. So some of these, kind of horrific diseases in our pets have been, as with parvo, controlled through the use of effective vaccination. So we've got a lot of great vaccines in vet med, and we really should be grateful, and we really hopefully can use them appropriately. And the challenge, of course, is that we do see vaccine reactions. They're generally quite rare, but they can be a concern. Some owners seem to concentrate their energies on these potential adverse reactions. And so we really need to be ready to have that conversation around this. And again, this gets back to all those concepts we talked about before around risk communication, around storytelling, around using visuals. So kind of taking these things together, pet owners should certainly, I would encourage them to be careful and to evaluate the benefits and risks for everything, that they put in their pets' bodies, just like hopefully we do for ourselves. And this certainly includes vaccines. And so I would also encourage people to look at the evidence. So use an evidence-based approach. So as a veterinarian, as a veterinary clinic, thinking about having an evidence-based vaccine program. So what's the evidence that supports certain types of vaccines that are out there and when we use them? And so this will optimize, the benefits, reduce risks, and so hopefully we can choose the best vaccines and the frequency for, that particular pet and that particular owner. And so I think with this type of independent evidence-based process, this will be very successful. And I also want to also emphasize that, we don't just stop here. We have ways to go. We certainly want to, and we have an obligation to continue to push our understanding of vaccines. And so this means, continuing to develop better vaccines, safer vaccines, and ideally optimizing the frequency of administration of these vaccines.
Sure. I mean, we talked a little bit earlier about the outbreak of canine influenza in the southern US, and it made everything you're saying make a lot of sense of, vaccinate and preventative care and all these things. I know that was several years ago at this point, and that's kind of my memory of infectious disease in pets. But how common are outbreaks of infectious disease in pets?
Yeah, great. I mean, great question. This gets back to some of the earlier questions, in that sometimes we don't really have any great data. We certainly know that we have outbreaks that happen all the time. So this includes, of course, the what we call quote unquote mundane outbreaks of CIRDC, or canine infectious respiratory complex, parainfluenza or similar pathogens that if you just look and just Google, you'll see them all the time in the news. And so these do occur with some regular frequency. The problem again is really that we don't have good surveillance programs. And without that type of program, we're going to generally underestimate the frequency of these outbreaks and the importance of these diseases as well, and how they occur. And I think something that really illustrates the utility of a surveillance program, and hopefully will be going in North America. There was an example, a group from the United Kingdom identified an outbreak of severe vomiting in dogs. And so they actually were using electronic medical records from a number of practices in the UK, and they were able to mine those data and actually see that they had a huge spike in the number of dogs that were presenting across all these veterinary clinics with the clinical signs of vomiting. And so they were able to actually link this outbreak to a novel canine enteric coronavirus. And it likely involved hundreds, if not thousands, of dogs over a several month time frame. So I think highlighting the importance of utilizing these types of measures as we go forward, so that we can really better learn from this. And without these types of surveillance programs, it's going to be really challenging to identify these types of outbreaks and to really get a handle on infectious disease in our pets.
What about quarantining? Do you think that the quarantining that pet owners were required to do in 2020 and still are having to make changes for today is going to impact the risk of infectious disease in our pets?
It's a really an interesting question. It's one that when the pandemic, we were first starting to go through lockdown and all these various things, we talked about this a lot. And I think there's kind of two sides to this. So, I mean, I think no question in my mind that this process of quarantining and self-isolating has a number of obviously dramatic health impacts for our pets. Some of these can be related to infectious diseases. Some of these, of course, are related to other health and behavioral problems. But let's focus on infectious diseases as an example. So, we know that many of these animals were, for instance, unable to get veterinary care, specifically, preventative veterinary care, likely didn't get, routine vaccinations or routine preventative care. Many clients didn't get the type of education that they might normally receive, for instance, during a puppy or a kitten visit. And so I think led to really huge gaps in prevention and in preventable components, and likely resulted in preventable infections. Now, on the other, flip side, so some pets level of exposure and risk might be adjusted in various ways. So we might see, for instance, reduced risk for some animals because they're spending most of the time indoors, or when they are outside, then maybe they're in close proximity to their owners or on leashes or other components, so that maybe had a lower chance of, for instance, acquiring an infectious disease. And then maybe the other flip side is people are bringing their pets into novel situations, such as dog parks or other locations, and where many animals are actually, as I said before, not receiving the preventative care they should have. So I think it's going to take us a while to truly understand what role the pandemic has had and will have on preventative care and the impact of that on infectious diseases in our pets. But I think there's no question that it is having an effect and continues to.
Absolutely. Well, Dr. Stull, it's been wonderful having you. Are there any final thoughts you'd like to share with us?
No, I guess all I'll say is for everybody that's out there. I mean, infectious diseases play such an important role in our pets' health and our health. And I think unlike many other conditions that we deal with in veterinary medicine, overall, many of these are largely preventable. And so trying to incorporate that into our day-to-day routines, whether that's part of infection control, whether that's part of preventative medicine, whether it's part of client education and communication, I think there's a lot that we can do to really improve our patients' lives, improve our clients' lives, improve our own lives in instituting those preventative measures and getting that information out and improving the veterinary care for our patients.
Wonderful. Well, thanks again for joining us.
My pleasure. Thanks for the opportunity.
Thank you, Dr. Stull, for your perspective and for the conversation, and thank you to Zoetis for sponsoring this episode. If you'd like to find more episodes like this, click on the Education tab on Vetfolio's webpage. As always, we'd love to hear your input on this session, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassie DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.